The meeting of the Ellis County Board of County Commissioners will now come to order. Let's stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Bobby, if you could call the roll.
Commissioner Joe LaRue.
Here.
Chair Butch Schleier.
Here.
Commissioner Neil Younger.
Here.
We have a quorum.
Okay, there are no changes tonight to the, or this morning to the order of business. And there's no executive sessions. Prior minutes, commissioners, did you get a chance to review prior minutes?
Yes.
Okay. No changes, concerns? Okay. Minutes stand as submitted. Consent agenda. Is there a motion for the consent agenda?
Yeah, I'll make a motion to approve the consent agenda, items A through G.
I'll second it.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0. Issues from persons not on the order of business. Yeah, no one's raising their hand, so I guess that's okay. Okay, we have the public forum guidelines. Did you want to go over those, Darren, or do you want me to?
It doesn't matter. I guess we didn't really visit how you want to do these each month, if or each week, if we only read them or say them aloud. Maybe when we have somebody wants to comment, or they'll be on the screen each time as the,
Sure.
the audience can see. But this was just kind of an idea that we came over the last couple of meetings to kind of give some guidance to the public when they speak on what's to be expected, to be respectful of everybody's time, and just to be able to move forward with a smooth commission meeting.
And what we're going to ask people as they speak from the public, what occurred a couple of weeks ago when we had a crowd in here, I think there were some people who did not come to the podium. Bobby couldn't get the minutes recorded maybe as she needed to. So what we're going to ask people to do is speakers are asked to stay, or speakers are asked to only speak at the podium. Speakers are asked to start with their name and organization. Speakers are limited to 3 minutes to make their presentation. And speakers are asked to make only points that have not been made previously. So given those things, Bobby should be able to record everything. We should avoid redundancy, and everything should go smoothly. Commissioners, do you have any concerns or comments with these?
Only thing I would like to possibly add to that is if they would present, if they're Ellis County resident or an outside county.
Or what?
Or an outside county.
Sure,
Okay.
they should state where they're from.
So you want me to add just their address?
Address, county. Yeah.
Mhm.
I will have that fixed by next meeting.
Okay, thank you.
Commissioner Joe?
No, it looks fine to me. I think if somebody needs more than 3 minutes, then, then either it's tabled and continued to another meeting, or if they're not on the agenda and they were able to come up and speak during the not on the order of business section, then that if they need more than 3 minutes, then perhaps that's kind of their cue to get on the agenda.
Okay, sounds good. Okay, moving on. Introduction of new employees. Jennifer?
Good morning.
Good morning.
Jennifer Taylor with Human Resources, and our departments have been busy filling their vacancies. I have 2 new employees with me. This morning, I have Jason Baskell, who's joining our Public Works Department as a heavy equipment operator, and he comes with multiple years of experience in the private sector. Welcome.
Nice to meet everybody.
And then I also have Brittany Thomas, who's joining our treasury, and she is a motor vehicle tax collection clerk, and she also comes to us with multiple years of experience.
Okay.
Welcome aboard.
Yep, welcome.
Thank you.
Our next agenda item is the health and dental insurance renewals. Darren?
Good morning, Commissioners. Darren Myers, County Administrator. Before you tonight is a couple different items to start talking about the 2023 health insurance, dental insurance, our agreement with our consultants from SCMI, and then that'll kind of move into a discussion with the Wage and Benefits Committee. First off, just to kind of discuss our health insurance package, I tried to explain this best over our phone calls with the commission, but I'll try to just pick out one plan and explain how that proceeds to be broke down with our renewal rates. Essentially, currently for 2022, a Plan A single plan cost total between the county and the employee share about $830. That includes a two-tiered plan. That's part of it's through Blue Cross Blue Shield. It puts money into reserves, it pays for their dental plan, and it pays our FCMI fees, which is per employee per month. That $830, part of that is a single plan. It's the same plan between Plan A and Plan C. Plan C's are a high deductible plan. But basically out of that $830, the rates for just the Blue Cross Blue Shield premium, like I say, it's a two-tiered policy, is about $500. When we received our renewal rates from Blue Cross Blue Shield, they were a 16.6% increase than what they were over the previous year. A big part to that is to looking at how many claims that we had that were $25,000 and over the last year. And I believe at this point through 2022, we had just about 20. When we were looking at budget proposals for next year, we only had, I believe, 4 at that rate. So there's a lot of large claims this year that were filed, which has an impact on how our insurance rates are adjusted. And visiting with Julie, which I'll ask her to come up here in a few minutes, 60%, I believe, is the rate that is determined. 60% of our rate increase is determined by the claims that we have, and 40% are claims that Blue Cross and Blue Shield is seeing outside of Ellis County. So a larger impact of our rate increase is based on what our actual employee claims are. So when we budgeted for the 2023 increases for health insurance, I suggested to the commission that we increase it by 7%. That 7% increase is on the total $830, not that $500. So when we actually saw the 16.6% increase on Blue Cross Blue Shield, that's only a 16% increase on the 500, which equates roughly right at 7%, which is exactly what we had budgeted. So that's the good news, is the rate increase has come in right at where we had planned on. It's higher than what we would like. This year we saw a 3.3% increase over 2021. And at that point, last year when we determined the rates, the commission had agreed that we were going to, that the commission was going to absorb that partial increase into our reserve fund and not pass along those cost increases to the county employees. This year, as I stated, the rate increases for Blue Cross and Blue Shield are there. For the Delta Dental, we have a 3-year agreement that says that they can't have an increase over a certain percentage each year, which they met that, and their increase also for next year is 7%. Right at 7%. So essentially when you bring that down, our employees pay 14% of their insurance plan and the county pays for 86%. So when you look at the total overall plan, for Plan A, a single plan is about $830. That's split 86% to the county, 14% to the employee. The proposed rate increasing with visiting with Julie with FCMI and with the Wage and Benefit Committee was to increase health insurance rates at that rate, which essentially would go from that $830 from a single plan to $850 per month. For a employee, when you look all the way down, you think a 7% increase is pretty big, but when you actually bring that down all the way to an employee level per check basis, based on which plan, you have a single plan or you have a family plan, it's about between a $2 and a $10 per check increase on their rates. As the commission has asked in the previous years for different options of what we could do to help the employees and also to curb the continued increase in employee benefit costs, was to absorb some of that into our reserve funds. As it is projected now with the rate increases that we have, with the money that we have set aside, and that current balance as of the end of August of 2022 was $1,030,000. And that's the money that we are putting into reserve that claims were being paid out of as a partially self-funded plan. Compared to where we were at 2020 or before 2020, all of those fees would have been paid to the state, and those fees would have been completely lost to the state plan because it was a fully funded plan. I can't remember the exact rates that if we were on that plan today, but if I remember right, it was over $1,000 a policy for a single, and we're still only $830, so that's still 20% less than what we would have seen if we would have been still on that state plan. So before you today are several options that we have. The first one is the continued agreement with FCMI, which is part of that $830 that we pay annually or monthly, and then a determination of what option the commission would like to proceed with. The Wage and Benefit Committee met, and they have accepted to suggest to the commission that all those rates are just paid for between the cost share between the county and the employee. And then the second option is for the commission to consider would be, instead of having that full rate increase of, like I said, breaking that down to an employee per check basis, $2 to $10 a month or a check, the commission could absorb 50% of those costs and reserve and only pass along half that increase to the county, to the employee, and then use the other half to use out of reserves. Our current reserve fund balance projected through 2023 at these rate increases will be roughly 199% funded, which means if every single employee, every single spouse, and every single child that is on that plan would meet their deductible, we would use 100% of our reserve funds. And as of today, or as of the projected year-end balance for next year, we're at 199%. So we're more than twice funded. The reserve funds, if the commission would like to absorb some of those price increases, would only reduce that funding amount from about 199% to about 193%. So very minimal impact to that reserve fund, which is one of the main reasons why we went with this plan with Julie and FCMI. So the first part, I guess, to get to the motion number one is our agreement that we have. As I stated, within that $830 a month that we pay for health insurance for a plan, $21 goes to FCMI. That's to Julie Armour and her crews down in Great Bend. The Wage and Benefit Committee, some of them will be up here and they can attest to some of their comments that they've heard from the employees. But it is very nice to, just the other day, the last comment I heard is the best thing that you can have when you have a medical issue is to call somebody and get a live voice on the other end of the item, and they say, don't worry, we'll look at it, and they'll actually get back with you on it. And that's what we're hearing from our employees. So with the recap there, the motion number one would be to reapprove the yearly agreement with FCMI, and I'd like to bring up Julie Armour, which is the owner of FCMI, to introduce her, as she is, I don't know if she's met Mr. LaRue or not, but she is the one that makes this all happen for us and got us moving to this plan. So I appreciate everything she does, and staff would have make the suggestion to move forward with her on the agreement.
Good morning. I'm Julie Armour, President of Freedom Claims Management, and truly appreciate the partnership that we've developed with Ellis County, and here to answer any questions and would love the opportunity to continue for 2023 on the same path that we've been in controlling those healthcare costs to giving the employees an excellent benefit.
Good morning, Julie. I have no questions for you. I think I understand how the insurance plan works very well, and employees seem to be satisfied with it. So I'm pretty good with it. Commissioner Neal, you have comments, concerns?
Just glad you're looking out for all our employees. Everyone, thank you for what you're doing.
You're welcome. We appreciate the partnership.
Yeah. Commissioner Joe?
Yeah, no questions, just to echo what Commissioner Younger said. You know, the benefit plan is a big part of the benefit package offered to the employees, and overwhelmingly, everybody enjoys their insurance plan, so thank you.
You're welcome. Thank you. Okay, thank you.
Thank you, Julie. Commissioners will act on these motions separately. Is there a motion on number 1? Do I hear a motion for number 1?
Sure, I'll move to approve FCMI administrative agreement and accept the Blue Cross Blue Shield and Delta Dental renewals for 2023.
I'll second that.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Okay, motion passes. With the next two motions, what we have to look at, Commissioners, is we can save the employees a few dollars every month if we absorb 50% of that cost into the reserve fund. And Darren, do you know what the dollar amount in the reserve fund is, or projected to be?
I'd have to pull up a different spreadsheet on my computer. As of the end of August of 2022, here is $1,030,000. And I
Okay.
believe by the end of 2023, if we were to continue with max disbursement of our allocation for reserve funds throughout the year, I think it would add just under $200,000 more to that fund.
Okay. So if we go with the third motion on the screen, it would save the employees a few dollars every month, and it really does no significant damage to the reserve funding. Any comments or concerns about that? Commissioner Joe?
Well, reserve funding is well-funded. It's trending very well for the next year, in addition to already being at a wonderful starting point. And I think meeting the employees halfway is the least we could do,
Okay.
to keep their costs down, to show our appreciation for them working for the county. And it also is, by meeting halfway, something that helps the budget itself.
Commissioner Neal?
I also like that because, as we all know, the workforce is down to hardly anything. Hopefully this will get word of mouth out and we can recruit some new employees.
Okay. Well, Commissioners, given what you stated, and I feel about the same way, I'll make a motion to approve the insurance premium rate increases for 2023 at 50% of the proposed rate.
I'll second it.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Okay. Then we're going to move to the wage and benefit proposal. Let's see, I gotta go to,
Good morning, Caleb Garner with Ellis County Wage and Benefits Committee. Never done this before, so I'll try not to butcher it too much here. I guess my first question, just for the sake of saving your guys' time, has everyone had a chance to read the proposal in front? Okay. One thing I would like to do is sort of introduce everyone here with the Wage and Benefits Committee. So we first came whenever the Ellis County got out of the collective bargaining agreement with the union. And we're just kind of a way between you and the employees. And so we have basically 5 different departments that we have with us. So with Public Works, there's Melvin Kinnerknecht and myself. For Office Professional, it's Amanda Shannon and Mike Weber. Law Enforcement's Tim Dinas and Braden Park. And EMS is Jamie Summers and Mike Fields, and Administration currently is Scott Brown. So we're here today kind of seeking your consideration for our proposal. I know one thing we had proposed is a 3% cost of living adjustment as long as every employee going up one higher step in their respective pay grades. The other thing that we had brought up in our previous meeting was a discrepancy in the pay scale. Currently, only pay grades 121 through 124 actually go out to step 20. And as you go lower in the pay scale, it goes backwards all the way to step 14. So 101 to 111, I believe, only goes to step 14. And One thing that we were wanting to see if you consider is extending pay grades 104 to 120 out to step 20. This will just help, so that way any new employees, anyone between 101 and 111, would be able to see that for the next 20 years of where they're going to be. Currently, it's after 13 years, they're sort of maxed out and kind of stagnant in the pay scale. And so one thing we were hoping for your consideration. Then the other thing is currently the county is not even using 101 through 103 pay grades. So we're also going to see if these could just be eliminated, just clean the whole pay scale up. And these changes would be effective the first pay period of 2023 if you did approve it. And finally, we are aware that with the new commission members coming in at the start of the year, if this was something that you wanted to table and wait until next year to discuss, then we are more than willing to do that as well. So I think that's pretty much it. Are there any questions that I can try to have the answer to?
I have no questions. Joe? Neil, do you have a
Nope.
question?
I have no questions.
Commissioners, do you wish to proceed with this, or do you want to table it for the next commission?
I would prefer to proceed with it.
Okay,
There's no reason to put off work that we're tasked with doing for 3 months. It'd make it real easy for you and I, though.
we sure?
We'll just
Thank
load
you.
up Neil and the 2 new guys for January, but no, we have a county to run, so I say we run it.
I'm in agreement with you, Joe. So we'll proceed to look at this. Let's first address these pay grades. We need to, if we want to look at this, we should increase pay grades from, trying to get this figured out here. We need pay grades from 121 to 124 to reach step 20.
So I guess for just some clarification, we have pay grades 120, or 101 through 124. Currently, grades 121 through 124 go out to step 20. As you
Okay.
proceed back from 119 to 115, I believe go to step 17, and then everything under 115 only go to step 14.
What was the intent behind that? To encourage people to progress to the next higher?
Correct. So, some employees, as you start with your journey with the county over the years, you'll start, towards the top of the pay scale, low-paying job, and as you progress, you get more experience, you'll be promoted, you'll move down, maybe move back to the left. That's as you move through management and is to be expected. However, some of the employees don't actually follow that trend, and they're here likely or longer. We do have this year, 2021, we did have one employee that is maxed out on her pay scale and did not get a step raise, but she only got a COLA since it was approved. Next year, for 2023, if you consider this proposal, there'll be 3 employees. And then the following year, I think we counted 9 that would all started to be maxed out at those steps. And some of those positions, actually several of them are in elected official positions. So there is no room for advancement in those positions unless their job description gets completely changed and we move them to a different pay grade, if that helps clarify that. And we did this similar thing this year with EMS. We had several of their employees that were maxed out on their pay scale because I remember, Mike, if you remember, if they were only 14 steps as well, and we expanded them out to 20 steps because there were
So-
several employees that were still planning on being here for many years that were going to be maxed.
We need to do the pay grades 104 to 120 out to step 20, is that correct?
Yes, sir.
Yes.
And if that's something that you would like, I could put together a new pay scale and send it to you for review, so you would actually, in the coming weeks, see what it actually looks like and what it would, how many employees exactly. And that way you can actually adopt a new pay scale at a future meeting, but it would take, I could have that done before you take into consideration of when their pay raises go into effect.
Okay. Commissioners? Commissioner Neal, any comments, concerns?
I'm gonna be the broken record, just like the health insurance. The word out in the street the better we pay, the more people we're gonna recruit in. They'll see this, and I've talked to several people about this already, so I'm all for it.
Well, and I would hate to see somebody hit step 14 in their respective pay grade and then go, well, I have no future here. And then potentially we lose that person because they like what they do and they don't want to move up to a different pay grade job, and then they leave us to go elsewhere to do that same job at a higher pay. So I think adopting, in that example, those 6 extra steps is giving them potentially 6 more years of progression. So I definitely want to send the message loud and clear to the employees that we appreciate them and we'd like them to be with us as long as possible, so.
Okay, Commissioners, then I will make a motion to extend pay grades 104 to 120 out to step 20, and to eliminate pay grades 101 to 103, which are not being used.
I'll second it.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes. Neil, did you vote?
Yes, I did.
Yeah, okay, no, motion passes 3-0. Okay,
I'll
And-
get that new pay scale for you and present it to you at a future
Sure.
commission meeting next month, maybe.
that's fine. And then you are proposing a 3% cost of living and a step increase, is that correct?
Correct, sir.
And what is the percentage between steps?
Percentage between steps, if I recall, is anywhere between 2.5% to 3.2%.
Correct. On the normal pay scale, it's about 2% for employees, EMS employees, because of their work shift schedule and working more. It's just over 3% per per step, I believe.
Okay. Commissioners, any comments or concerns with that?
No, even when you add the step increase percentage for those who advance as far as seniority or tenure goes, when you add the 3% COLA, which falls under the set-aside amount, so the budget stays whole, even then, you're just about keeping pace with inflation. So I'd say, again, it's the least we could do.
Okay, Commissioner Neal?
Yeah, like I said, the better we treat our employees, the more productive. The COLA, I'm for that also, because I'll support that. Doesn't matter if we're up here, you guys are there, your shoes, your clothes, everything costs the same, so I'm good with that.
Okay. I guess the only concern I do have with this, and I mentioned this to Darren, is with a 3% cost of living raise, you could possibly get behind with the salary itself, the whole pay grade. Once you get behind, it's going to be really, really hard to catch up. So I just caution you with that. I would encourage any future Board of Commissioners to never, ever again do a salary and benefit survey. The last one was a disaster. And I know because I was there and I worked through it. And we had employees fighting with each other. So I would never want to see the county go down that road again. So I just caution you with that. With that, Commissioners, we will make a motion to provide the employees a pay increase of 3% and a step increase to the next step. Is there a motion for that, or a second?
I'll second it.
Consider when you want that to be effective.
We will start that the first of the year. Okay?
Okay, I'll second it.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0.
Thank you.
Thank you.
Just for clarification on that too, as we make those changes, we're going to be getting close to the point of entering all of the budgets into CIC with the clerk's office. So before Bobby enters all those in and then we have to readjust them in, I will have a adjustment to the budget to reduce the budget stabilization account and increase those into that. So that way Bobby only has to enter those into CIC once for each department and all the line items in regards to personnel expenses. I'm sure she would appreciate that.
Very
Okay.
much.
The only piece left to this that's not mentioned in here is these pay adjustments are for employees. These do not include the elected officials.
Mhm.
So as a reminder, the salaries are set by the county commission through a resolution on what those annual salaries are. So I can visit with each of you offline, and at a future meeting, we can discuss what you would like to see, those adjustments, if you'd like to make adjustments to the salary, or for the elected officials. And I will commend the Wage and Benefits Committee for taking that into account. As you can see, the amount that they proposed was under what the budget that the commission set aside, in recognition of allowing those additional dollars to be used for the elected officials' salary adjustments if needed.
Sure. Commissioners, I'd like to see the elected officials get the same increase the employees got. I think that's the only fair way to do anything.
It's fair
so.
way.
And so what we did this year was, you have a salary range between where you're at, and with this proposal that you have, the employees will see roughly between a 5 and a 7.5% increase based on where they're at on the scale and how many years of experience. For this year, what we did is just split that in the middle, and that's what the elected officials received through resolution. I could put together budget numbers and a new resolution for a future meeting when we revisit all this, if that's what you would like to see.
Okay. Sounds good, Darren.
Yeah.
Okay, next is the electronic health record for the health department. Kim?
Good morning, Commission. Kim Reel, Director of the Ellis County Health Department. This morning I am bringing to you the opportunity of a new and updated electronic health record system. It's called CureMD. We have spent the last couple of months since the Governor's Public Health Conference talking to several EHRs to determine what would be the best route for us to go. If you have not been into the health department, we currently use KIPS, which is predominantly an old system, and it uses a lot of paper. So by going to CureMD, this will allow for us to streamline our current process, which yesterday is a prime example of it. We had 73 people come through our doors yesterday for flu shots, and some of those people did wait 30 minutes or better just to get checked in because of our current process. So CureMD is currently being used by KU Med as well as Wichita State. It will have a self-scheduler on that, and so if you were to go on to schedule an appointment with us, that is the beginning of creating a chart, if you will, with us, where you can then go forward and put your history in, put your medications in, things of that nature. We currently do not have anything like that. CureMD will allow for us to customize the electronic health record the way that we see that it will fit us best. Furthermore, they have training online, which we have looked at. Marin has her own training as an APRN. Desiree had her own training as a biller. The front office staff have their own training, as well as the nurses. And we have already been through this training just to see what it would look like. It's a very simple process to use for us, and it will pretty much eliminate the repetitiveness of what we're currently doing. Marin can e-scribe her prescriptions. She does not have the ability to do that now. She calls everything in. CureMD will allow for us to provide educational material right then and there to our patients, or we can attach that to the patient portal, which they will have access to, and then they would have access to those educational documents going forward if they want a chance to review those at any time. CureMD will also integrate over everything that we currently have on KIPS, as well as VaxCare. All of that information will go straight over to their system, so we won't have to necessarily repeat everything. We will just need to double check driver's licenses and insurance information as patients come in. Additionally, they are looking at adding the EpiTrack system, which is what we use for disease investigation. And then we would be looking at adding the DAISY system in. If we look at getting grants like family planning or maternal child health into And then this will also help us to create reports going forward. Are there any questions? Anything I didn't currently go over at this point?
You did make me feel kind of old when you said KIPS is an old outdated system.
I'm sorry.
Because I was in the health department when I bought that.
I know, sorry.
And gentlemen, the KIPS system, when we got that, was a very good system. It was developed by a gentleman from Wichita, Pete Kitch, and he worked hard with KDHE, and I think at one time, almost all of the health departments had that system. It was very good for what it done. It helped provide the codes to procedures, which helped with billing. It definitely lacked with reports, even though they kept trying to improve those things. And there was never anything in the system what was any good for charting. Charting just wasn't very good with that. So, and I believe when I bought that system, the KIP system cost $10,000, and my annual fee was $2,500 a year.
It's now 3,800, yes.
38 now, okay. So when I left, it was about 2,500. So it's probably time for something new. Someday someone's going to tell Kim,
Yeah.
new one's an old outdated system.
That's
too.
correct. That is correct.
So I'm in favor of the purchase. I think it needs to be done. It seems to be priced reasonably, and the first 4 years would be paid through a grant.
That's correct.
So that's a bargain right there. Any concerns or questions, Neil?
Just what you were saying, you know, for the price of it right now, that's not a bad price, really, from when you were in that position. So, yeah, I would definitely support that.
Yeah, and then presumably the monthly cost for the current system could be applied towards the new system by the time year 5 hits, and it really won't change your budget significantly. And,
Correct.
And, you know, and then on top of that, the county has a newer system, so I'm in favor of it.
Okay, well, commissioners, is there a motion for this?
I move to approve Cure MD as the new EHR for the Ellis County Health Department.
I'll second that.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0.
Thank you.
Thank you, Kim. And I got to go down to 50. Okay, our next agenda item is removal of land from the ETJ. Justin?
Good morning, Commissioners. Justin Craig, Environmental Services Director. So before you this morning, with the land that was purchased for the new county shop on the north edge of Hayes, that land was previously in the extraterritorial jurisdiction for the city of Hayes. So Mr. Jeter, Darren, and I have been working with Toby and Curtis with the city of Hayes to amend that agreement to remove the north half of Section 16, Township 13, Range 18 from the ETJ and put that under our jurisdiction. So.
Okay, and as you've worked with City of Hayes, they had no objections to this?
No objections.
Okay, that's good.
Mhm.
Commissioner Joe, concerns or comments?
No, I don't have any comments or concerns.
Okay, Commissioner Neal?
I'm just glad that City Hayes worked with us.
Yeah.
So that's what it's all about.
Okay, well, if we, I think this is probably the best way to go ahead and do this, and is there a motion for this?
I'll move to approve the adoption of the amended agreement with the City of Hayes on boundaries to the ETJ of the City of Hayes.
I'll second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Okay, and then we have the landfill expansion permit.
Yeah, once again, Justin Craig, Environmental Services Director. Pinko Engineering, they finally completed the application to submit to KDHE for the expansion of the landfill. This document just requires your approval to get back to them, and if approved, they will submit that along with their final plans to KDHE to get our permit to move our expansion up north and start putting waste up there.
Okay. Have you got the land moved from up north yet?
We've started on the south half of the first section, trying to get it dug down, so when we get the approval, we can just head right over there.
Just get started. I know you guys are kind of running out of room out there.
Yep.
I was out there about a week ago.
It's
getting
getting
full?
close. It's getting close.
Yeah. Okay, well, I guess if we want to expand the landfill, we're going to have to get the permit to do it, so, any concerns, comments, Joe?
No, sir.
Okay, Neil?
No?
Okay, is there a motion for this?
Yeah, I'll move to approve the KDHE permit application 1-5-2022 for the expansion of the Ellis County landfill.
I'll second
We have a motion and a second. All in favor, say aye.
it.
Aye.
Motion passes 3-0.
Thank you.
Thank you, Justin.
Thank you, Justin. Okay. The next is the over-under tax payments resolution. Vern?
Morning, Commissioners. Vern Reuter, Ellis County Treasurer. After talking with other treasurers around the state, we are asking to pass a resolution for something that we've just had office policy for collecting taxes. Everything, let's see, everything under $1 we keep, and everything over or less than $5 we don't send back. Cost of mail, post, labor, envelopes. So we're just looking at getting a resolution passed, you know, for the best interest of our, you know, county to make a resolution.
Okay. Do you find that occurring very much, Vern?
It happens, what, how often would you say?
It happens daily,
Yeah.
Okay.
but not in tens and 20s
Mm-hmm.
amount pieces of mail.
Yeah, in 2021, at the end of the year, we were $28 positive. And then so far this year, we're $10. So it just kind of, someone sends in an extra $1, $2, sends us, you know, 50 cents less, kind of averages out, so.
Right. Well, when it costs more with the effort, it's no longer worth it, so.
Yes.
Yeah.
And as a policy, I thought it's probably best to have a resolution set in place.
Sure. Commissioner Neal, concerns?
I'm good with that.
Okay. Commissioner Joe?
Yeah, no, it makes sense. I'm fine with it.
Okay. Is there a motion for this?
Sure. I'll make a motion to approve Resolution 2022-15 for over and under payments of ad valorem taxes wherein their costs are greater than the benefit.
I'll second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0.
All right, thank you.
Thank you, Vern.
Thank you.
Okay, the next is the KDOT Build Grant Update Agreement. Darren?
Darren Myers, County Administrator, speaking on behalf of Brendan McKay, the Public Works Director, as he's out of town this week at one of his last classes for a CPM course. Before you today is the updated agreement with KDOT for the Northwest Business Corridor project. What this basically states is going back through the cost ratios and the amount of money that the county is spending compared to how much KDOT is contributing, compared to how much Federal Highway has granted us. Those allocations changed, and the KDOT is still claiming that they're going to pay for $1 million of the project is the cost of the project. So with those cost allocations change, we just need to update the agreement just as we done about a month ago with the Federal Highway. And this just updates a similar agreement with KDOT. And
Okay.
we'll get it, if approved, we'll get it sent back off.
Okay, well, it sounds like a good plan. They're still going to contribute their $1 million, and if the feds give us a little extra money, that's money we can put back into road and bridge projects.
Correct?
Yeah. Okay. Commissioner Neal?
Yep, I'm good with that.
Okay. Commissioner Joe?
I'm fine with it.
Okay, is there a motion?
Yeah, I'll move to approve and sign the supplement agreement SA2C-5035-01, building roadway improvements.
I'll second it.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Okay. Okay, next we have the sheriff's office door installation. Scott?
Good evening, Commissioners. Sheriff Scott Brown, Ellis County Sheriff's.
Morning,
What did I say?
evening.
I'm used to it, same thing. So it is nice to have it in the morning, though. So take a little bit to get used to that. Before you, I'm assuming you had the opportunity to take a look at that. So we've changed up our process, and as some of you are aware, when the facility was built, it may not have been built in the best way, and we're not utilizing holding cells that should be a holding. We're using that as a processing room. And so what I'm offering up basically is to cut a hole in the wall, which is where the garage door used to be, the old one. It's a block structure, as you can see, and then putting a 36-inch steel door. What that will do is that actually is our bonding room right now, where they would bond, do their paperwork. That will allow us to use that as a processing room for all officers that bring inmates in. And I didn't take a picture, I should have. That will allow us to use those 2 holding cells to place the inmates in after they're done. It'll be much more safe. It gives us a better way, because currently we're going through that holding cell into, and then we're placing them in a cell, and we really should have them secured in there until we can properly search them before they actually enter our bonding area, or our holding cells, for a more permanent location. Sorry about stumbling there. I knew what I wanted to say, but it didn't come out that way. So currently, the reason I'm in front of you is I wanted to see if you guys would support this before I go ahead and put out some bids and ask for some bids on this process. I have an estimate that I think it should run, but we all know how that works. Funding-wise, Darren and I have talked about a couple of different options. If my current budget continues the way it is, let's hold our breath. I should have adequate funding to cover that under the current budget, but that could change. And if that did change, we would back up and punt and then discuss it. So I'm asking for your support in order to proceed with that and seek some bids on that option. Do you have any questions for me?
Well, I think what you're talking about, Scott, is a safety issue.
It is.
It's for the safety of the officers involved in this whole process, to get them people into the proper location so they can be processed properly.
Correct.
Without being put in a cell first. And so, yeah, I'm in favor of you exploring this and seeing where it lands.
Okay.
Commissioner Neal?
Yeah, I will support it. You have adequate room for whatever the lockers are. Where are you relocating those at?
We'll just move those over against the wall on probably would be the east side, so we will have plenty of room for that, yes. But thanks for asking.
Okay.
Commissioner Joe?
Yeah, I'm also supportive of it, be it a safety issue and to build in a more efficient workflow for when somebody's booked in and whatnot, so.
Okay, so good luck, and I hope the bids or the estimates will come in to what you expect.
Yeah, me too. And then I would also like to bring, if I may, update on the camera systems that we did so long ago, it seems like forever ago. That is actually going to start here in about a week. So they will get in there and get that system up and running and updated for us. So that's exciting news, and replace some of those cameras and get some installed in those cells that need them. And then last but not least, what I would like to do is thank you for supporting our employees. It means the world to me, and I can't thank you enough for you commissioners voting in support of giving our employees raises and taking care of them through the insurance. Thank you very much.
Thank you, Scott. Okay, with that, we have a county administrator report.
Once again, Darren Myers, the county administrator. I just have 2 quick items. Commissioner Younger asked me yesterday to bring up, just to confirm that the commission was, approved to have Commissioner Younger be the representative for Ellis County at the Oktoberfest event this weekend. I believe that's what we had discussed, but I figured it'd be easier to ask today than look back through all the videos.
That'll be fine.
Okay. Then the second thing I just wanted to recognize is the commission has approved earlier in the year, which will be in the updated personnel policy that we're working on. Monday, October 10th, the county offices will be closed for the Employee in-Service Day. So I guess that's part of it, is Carissa has made some public announcements for the public to let them know that our offices will be closed on Monday. The landfill still will be open. Obviously, EMS will still run EMS calls, and the jail will still be open, and sheriff's deputies will be out, et cetera. But all of our other employees will be out at the fairgrounds for a lineup of different things. It's open enrollment time for our health insurance, so with the approvals you made tonight, our employees will be out there meeting with FCMI, AFLAC, New Horizons, getting to visit with all their vendors that supply us with different benefits. We'll have a Stop the Bleed course with Hayes Med and EMS for all the employees. Public Works will be doing forklift safety in the afternoon. We'll have a retirement and savings and market course, kind of just retirement budgeting course and everything with Worth Financial. They're coming out to speak for about an hour. We'll have about an hour and a half, which Commissioner, to the chair, will be out to speak with the employees for a little bit, and then we'll kind of give a State of the County address as to different projects. We'll introduce a lot of the new employees, new department heads, go over our new human resources management system with the employees. So it's kind of a fun-filled day. I don't know, I hope it's fun-filled, but I guess Dallas Hazelhorse will also be there with Treetop Security to speak on cybersecurity issues, as that's a very important topic to us. So we'll all be out there, and if the other two commissioners do want to show up, I know you have a safety meeting in the morning, I believe, but we'll be out there all day. You feel free to pop in, and we'll bring you up front and let you talk to everybody if you like. So.
Okay, sounds like a plan. Commissioner reports. Commissioner Neal?
I did attend the Hayes disaster plan again, which was, there was more attendance there, getting some new people involved, and including Ellis County Public Works and the City of Hayes. And I also did drive Ellis Avenue, so I'm kind of ready for next Tuesday. And I attended the Ellis City meeting last night. And I'd like to thank I know there was 120 some calls that the volunteers that went away from their families and helped our community out. The other thing is, we have changed our meetings now to Tuesday. Is there a chance that I can get a new from October through December, the dates? That way I can put it on my refrigerator at home and know. But if that's possible. And then also I'd like to wish Mr. Dean Klaus a happy birthday and Shannon Smith a belated. And then all the rest of them, Mr. Anderson, of this month. So all of them have a nice happy birthday.
Okay,
All I have.
Thank you, Neil. Commissioner Joe?
Since the last meeting, I attended the Kansas Association of Counties Governing Board meeting in Minneapolis, and that was a good meeting. And then another Kansas Workforce One board meeting, and I also had the chance to visit with the Victoria Community Coalition again. So that's all I have.
Okay, and I have no report. And if there is not anything else, we will adjourn this meeting at 9:24.